So we've been talking about osteoarthritis for the last few weeks in Friday Value video, and I really wanted to continue on this because it's so important that we make informed decisions. This isn't about telling you what to do. This is about telling you what the facts are, what the data shows, so that you can ask better questions, so that you can be more informed when you make decisions that intimately impact your own physiology, your own life, your own body, right? So we're going to continue on. Last week, we talked about common medications, the risks and the benefits for OA. Now we're going to talk about injections. And it's important that we understand, a lot of these treatments are relatively commonly recommended. And very often you're not really made aware of any potential risks. And so because it's done so often, we start to think there's no risks involved, right? And there's always risks. So let's look at this. Steroid injections for osteoarthritis. Do they work and are they safe? Well, corticosteroid injections are very commonly given for shoulders, elbows, knees, hips, SI joints, and the spine, the neck, the low back. There are risks. Death of nearby bone, osteonecrosis. Osteo means bone, necrosis means death. Joint infection, nerve damage, cartilage deterioration, rupturing and weakening of the tendons, which is how the muscle attaches to the bone, and then thinning of nearby bone or osteoporosis. So yes, and this is right off the product information, the people who make it. So I'm not making this stuff up. These are the risks. Most people aren't aware there are any. So let's look and see, do they work? All right. I mean, you might be willing to take the risk if the data shows that it really works. Well, this was a really well done study that looked at patients for 2 years, 2 years of injections, steroid injection to the knee for osteoarthritis, painful knees. Now, if you follow me for any time, you know that a lot of the times knees hurt because your power source up above isn't working or your ankle down below isn't working. Yeah, you might have some arthritis in the knee, but that may have nothing to do with your pain. That's a whole nother topic. I don't want to talk about how imaging doesn't always line up with symptoms. Maybe I'll do that next week. But for the most part, understand that if the arthritis in the joint isn't what's causing the pain, the injection's not going to work, for one thing. But let's look and see, is there any risk, right? Does the risk outweigh the benefit? So here's 2 years of injections compared with somebody who got saltwater injection, which of course, saline, that's an inert object. It's not going to do any harm, right? Significantly greater cartilage volume loss and no significant difference in knee pain was seen with those who had the steroid injections. So their conclusion, these findings do not support this treatment for patients with symptomatic knee osteoarthritis. In other words, if you've got painful knees and we're thinking the arthritis is what's doing it, injections don't really bear weight with the data. And guess what? You could end up with more cartilage loss. Let's look at the hips. Here's a study that said these injections could actually be deleterious and may spur osteonecrosis, death of the bone, and bone collapse. Say what? They looked at 3 groups, over 100 people who had hip osteoarthritis that showed up on X-ray. They had over 100 people who also had it, but they did not give them steroid injections. So they were the hip control group. And they did a 3rd group where they had a shoulder control group where they got steroid injections in the shoulder. And you might think, why on earth would they put them in the study? They were trying to tease out a variable and say that it wasn't just because the steroid got into the system, right? It mattered where it was injected. So here's what the radiologist reported based on what they found on imaging after these injections. 22 to 24% of those who had steroid in the hip showed new death of bone, compared to only 9% of those who had no injection in the hip and only 5% of those who got the injection in the shoulder. Here's another thing that they found. Bone collapse in the head of the femur bone, which is the top of the leg bone, the top of your thigh bone that fits into the socket. That's what makes up half the joint. 15 to 17% of them in the intervention group showed bone collapse versus only 4% in the control group that had no injection and 2% in the control group that had the shoulder injection. So rapid changes in bone seen in the intervention group. This was what the radiologist reported. Changes due to osteoarthritis, such as narrowing in the space between the joints and developments of little bony proliferations, little bony spurs and things, typically develop slowly over time. When reading follow-up x-rays of patients who had received the hip steroid injection, we noticed changes had developed rapidly in some patients. So again, risk versus benefit. Does the benefit outweigh the risk? Only you can decide that because it's your body, your physiology, and your life. I'll see you next week.